guys, it's me Happy Crisps, also known as Mansa. That's my real name. Anyway, welcome to my channel. Today I'm here to talk about what does an audiologist do? Who is an audiologist? So, all of you know an ENT doctor, right? He deals with your ear, nose and your throat. Anything affecting any of these, you would go to an ENT doctor. If you have a hearing loss, would you go to an ENT doctor? Yes, but also an audiologist. An audiologist is the actual professional who would be dealing with your hearing, because ENT doctor only tests your ear and sees what's wrong with it. But what about your hearing? Your hearing is a complex and a multi-dimensional thing. It's not just something which, a ball dropped and you heard it, or something dropped and you heard it. Your hearing is a huge thing. You hear low frequency sounds, you hear high frequency sounds, you hear things which are far away, which are nearby. You hear so many different things every day. And who can assess all of that? An audiologist. An audiologist is involved in the identification of difficulties in hearing, in assessing it and finding out what is the exact level at which you are hearing, and in providing treatment as well. Yes, an ENT doctor can give you medicine if it's something like, you have an infection or a block or an itchy ear. All of that an ENT doctor can help you with. But what if your inner ear is affected? Yes, your ear has 3 different parts. An outer ear, which you can see right here, a middle ear, which involves something beyond the eardrum, where there are bones over there, and then the inner ear, which involves the cochlea and the nerves. So your audiologist is involved in all of these parts, and your hearing is actually by all of these 3 parts together, which work along with your brain. So if you have a hearing loss, any of these parts could be affected, and an audiologist can help identifying where the hearing loss is and finding out what can be done further. An audiologist doesn't give you medicines, doesn't give you any type of surgery to correct this, but he can guide you as to what should be the next step, what is the exact level of your hearing, how you can make your quality of life better, because once you have a hearing loss, it does affect you socially. You can't hear people, you can't understand what someone's saying. If someone's talking to you, you often rely on their facial and body language to understand what they're saying. So this affects your social life as well. But an audiologist can help identify what's the issue and then deal with it. How do we deal with it? Depending on the type of loss, they would provide you with hearing aids or cochlear implants or other devices which basically help you hear. All of these devices help your ear do its job better. So other than this, an audiologist is also involved in balance. Yeah, did you know that your ear is responsible for balance as well? So if you feel giddy or dizzy, an ENT doctor would often refer you to an audiologist to check the status of your ear. Another thing audiologists deal with is tinnitus or ringing in your ear. Have you ever had this gooey sound in your ear? If you do, or if you have any other different kinds of sound in your ear, an audiologist can help you identify what is the issue, why is it happening, and to provide treatment as well. Other difficulties like blocking sensation in your ear, fluid coming out, and maybe some other kinds of difficulties where it's affecting your hearing as well as your ear, an audiologist along with an ENT can provide you with the correct treatment and the way of overcoming that. Other than this, there are other disorders which affect hearing as well, like they have difficulty understanding speech, or after a stroke they're having difficulty, or they're feeling they're not able to understand what you're saying properly. All of this also an audiologist deals with. It's not just that hearing can go in your older age. We all assume, only an old person, he can't hear, he's become old. No, you can be born with a hearing loss. An audiologist can help with that, and then an audiologist can help you if you get a sudden hearing loss, maybe due to music exposure, noise exposure, or an infection, or a seizure, or fever. So many things can affect your hearing. And the next step, maybe because of medicines, if you're having diabetes, BP, cholesterol, sugar, any of these things, and you're taking medicines for this from a long time, that can affect your hearing as well. Maybe you work in a place where you're exposed to a lot of noise, that can affect your hearing. All of these ways can affect your hearing, and all of these things an audiologist deals with. So the next time somebody says I'm an audiologist, don't ask, oh, you mean radiology? Yes, I have heard that. Or don't ask, oh, you deal with music and audio files. No, audiologist is a professional who helps you hear and makes your life better. Thank you for watching. It's me, Happy Crisps.